you wanna, are you, yeah, you are.
Good evening, everyone. I'm sorry for the delay. This is the Health and Social Services Committee meeting, but we ran a little over on the bylaws. Joanne will read the conduct statement, and then we will introduce ourselves and the speakers. Go ahead, Joanne.
Okay. Community Board 11 meetings must be held in a professional and hostile-free environment. The following rules of conduct are applicable to members of the public, Community Board 11, and Community Board 11 staff. Any action or behavior that disrupts or interferes with Community Board 11 business will not be tolerated during any Community Board 11 meeting and may result in the individuals being asked to leave. If the action or behavior continues, this may be considered disturbing the peace, and the appropriate authorities may be summoned. If the meeting is held remotely, the person may be muted or expelled from the remainder. Repeated violations by the same person or group people may result in further action by the community board. All public speakers must address the full board or the committee with their concerns. Electioneering for a position other than an officer of Community Board 11 is prohibited. Engaging in acts of violence, including threats that are grounds for immediate suspension of the right to attend meetings, pending review by the Ethics and Disciplinary Committee. Respect the equality, diversity, and privacy of all persons, respecting and valuing differences of culture and opinion. Refrain from unpleasant or disparaging remarks and other actions. Abstain from all forms of harassment by actively discouraging it. Disseminating false information is prohibited.
Thank you, Joanne. All right, we will introduce ourselves. I am Sandra Unger, Chair of the Health Committee.
I'm Joanne Rubino, co-chair.
David Levitt, member of the Health Committee.
Pat.
Pat Cambria, member of the Health Committee.
And.
Diallo, part of the Health Committee.
Okay.
Sandy.
Yes.
So Veronica, it's really quick for her. Do you want me to mute everybody and not give them the ability to unmute so there's no interruptions later on, and they can only be called upon when you
All right, that
them,
makes
whatever?
sense. I just want,
Okay.
because we have the two of the three speakers are here.
Yeah, so Michelle, I can make a co-host so she can unmute herself, if that's
Okay.
helpful.
Yeah.
Yes.
Michelle.
Okay.
All right.
Thank-
There are no minutes to review because we did not have a quorum last meeting. Oh, no, we did. Excuse me.
Right.
About Live On New York.
Right.
And the minutes will be forthcoming. All right, now the guest speakers. All right, first there was supposed to be Takira Simpson. I don't see her on, but we have Michelle or Anel Lee, coordinator for Selcorp Centers for Occupational Health. Michelle, you're on board.
Okay, she has to be unmuted.
Unmute her, please.
But she can unmute herself.
Michelle, you could unmute yourself.
Okay.
Okay.
Hi, how are you, everybody?
Hi.
Hi.
Am I able to share a PowerPoint presentation for you all to see?
Yes.
Yes.
Yeah,
Okay.
you should be able to. You're a co-host now.
All right, you're getting started.
Okay. Do you all see what I'm looking at, the presentation?
Yes.
Awesome. Perfect. Well, thank you so much for having us today. Again, I am representing Mount Sinai Salakoff Centers for Occupational Health, and I am the Outreach and Education Program Coordinator. So before we dive in, I would like to start with some definitions. Our clinic does get confused for occupational therapy, and I just want to make sure that you guys know that we are not OT. So occupational medicine is a specialized field that focuses on the diagnosis, treatment, and prevention of work-related injuries and illnesses. And individuals that are injured during the course of their employment or who suffer work-related illnesses or injuries require specialized care and may be eligible for workers' compensation benefits. Now, there's two things that can happen to us. We have an occupational injury, and this is any physical damage that occurs due to the nature of our work, including accidents or repetitive motion injuries. This is your sprains, fractures, burns, and falls, depending on the job that you do. And we have illnesses, and this is exposure to certain factors in the workplace that may cause you to become sick, such as chemicals, noise, or physical stress. So, for example, with this one, it'll be a nail technician, right? They're exposed to certain chemicals for X amount of years, and then eventually maybe they'll develop dermatitis on their skin or some sort of asthma. So, this would fall under the illness category. Now, Mount Sinai Salakoff Centers is part of the New York State Occupational Clinic Network, and this network is also comprised of 8 other clinics. New York State is the only state that's dedicated to the field of occupational health and diagnosing, treating, and preventing work-related injuries and illnesses. So this is what we offer. We offer no-cost confidential care for work-related injuries and illnesses, including diagnoses and treatment, regardless of the person's insurance or their documentation status. We support for accessing services and benefits and assist with the entire workers' compensation claim if the person chooses to file. And we also do a lot of community outreach and education and collaborate with unions, community groups, work centers, and local officials. These are the following health services that we do provide. We do confidential medical exams. We offer specialty care coordination, so we link workers with needed specialty service. We offer workplace hazard screenings for OSHA mandated screenings and exposure assessments. We offer disease prevention and education with a focus on occupational risk and prevention strategies. We offer workplace evaluations through our ergonomics and industrial hygienist program. We do return to work accommodations. So we have the social work and benefit counselings that help address any personal or family issues related to the injury or the disease. Again, we have a team that does the entire workers' compensation assistance. And lastly, we also have the World Trade Center Health Program, where we help enroll any volunteers that were down there during 9/11. So how can we help? We do assessment and follow-up. So our doctors will assess whether the injury or illness is indeed work-related. They provide follow-up care and initiate the workers' compensation process if needed. Patient safety and prevention. We prioritize treating the work-related condition while focusing on patient safety and preventing further injury or illness from workplace hazards. And we do a lot of collaborative care. We work closely with referring physicians to ensure seamless continuity of care. Again, sometimes we don't have certain doctors that maybe like a podiatrist that you would need to follow up with. So that's someone that we would connect you to. So we do have 4 locations. Our closest one would be our Manhattan location, and this is in Harlem. We have one in Staten Island. We have one in Yonkers and one in Suffern County as well. This is just how we collaborate and work together. So simply by sharing this flyer to the community to make sure that this services is there for them in case they ever get hurt. And then lastly, we've also developed a 1-hour workshop for youth ages 16 to 24, where they learn how to recognize hazards at work, their rights when working in New York State, and they learn a little bit about the field of occupational health. And that was all for me. Do I have any questions?
Well, I have 1 or 2. One, what phone number do you have so that if someone needed to assess
right
your
there.
phone? Oh, there it is now.
888.
Okay.
Michelle, while you were speaking, the PDF on our side only stayed on the first page. If you could send it to our board office
Yeah,
so
that
we
one.
can have it disseminated to the board members, that would be great.
Sure.
All right, thank you. Also, since you don't have an office in the Bronx, I guess the closest one, if someone needed help, would be Yonkers.
Yes.
Or Harlem,
Well,
but I-
yeah, if they have a car, for sure, Yonkers would be the closest one. But if their only option would be to maybe commute by train, I live in the Bronx. I live on Burnside Avenue, so it takes me maybe like 15 minutes to get to the Manhattan location.
Yeah, but it's within the Manhattan location, it's on the west side.
Um, I think so. Yes. Sorry, I work remotely, so I'm barely ever there. But
Oh,
it's on like
yeah.
96th Street.
Okay. All right, all right, thank you for
I
that.
have a
And
question.
Joanne has a question.
Okay, the question is, what is I mean, you're obviously outreaching to us, but what about employers? How, is there an outreach to, I mean, there's so many employers in New York, but how, do the employees get informed about this? I mean, community board is one thing, and that's wonderful, but how, because there's so many employers, how is that handled?
So, the way we do outreach to employers would be through mostly their unions. And we try to again do these presentations for them, not only for the Salakoff but also for the World Trade Center Health Program, because it kind of all falls under the same umbrella. The people that were working during 9/11 were exposed to the dust and debris while they were doing their jobs, right? Like NYPD officers or anyone that was really volunteering. So we do outreach just like how we're doing it today for the community board, to employers as well. So we try to connect with unions mostly.
Right, and but there are many employers that, that there is non-union employees. So how do they find out about this?
Well, as my job as the outreach coordinator, I really reach out to everyone that you can think of. I have a gazillion of people of different community-based organizations that I've targeted in the 3 years that I've been here, and it's different. They provide different services, right? So my job is really just to get the word out, because anyone from any type of job and any industry can get hurt. Whether you're doing construction or you're a nail technician, you should know about this clinic. So again, I do presentations, and I try to connect with different community organizations, whether it's me going out and having a table for a health fair event just to spread the word, or just via email as well.
Gosh, I think I signed you up already for the health fair, correct? In May, because I figure if I'm gonna do one, I do the other. But what about like houses of worship? Do you get to
Yes,
speak to
so-
the leaders and arrange things?
Yeah, so my first year working here, I did a lot of presentations with different churches.
Mhm.
I think.
All right.
Is there anyone else who has questions or comments? All right, so Michelle, you will send us the information which we do not see. And
Yes.
thank you so much
Of
for
course.
your information.
Thank you so much for having me.
Thank you. Wait, let me see. Is there anyone in the gallery who has a question? I don't see any hands up.
Hold
Okay,
on, let me check
wait, check.
just to be sure. No hands up.
No hands
Okay.
up. Okay, the next person to speak is Madeline Brand von Brenner, who is the planning fellow for Community Board 11.
Okay.
And she's
Great.
going to discuss her survey. And unmute her.
Hi,
Sorry.
folks. How are you?
Okay,
Hi.
fine.
Hi. Okay. So I'm going to share my screen. Let's see. Okay. Can you see?
Yes.
Well, yes.
There you go. Yep.
Okay. So my project is titled Aging in Place with Access, Evaluating Community Board Strategies for Senior Outreach and Resource Navigation. And some background on me is I'm currently working at New York Connects Brooklyn, which is a Department of Aging funded program serving seniors, people with disabilities, and caregivers. And my job is to provide information, assistance, and referrals to community-based services. So that's really given me, kind of informed the background of this project. And the Community Planning Fellowship is really designed around, mostly has an emphasis on the built environment. And so at the end of my presentation, I'll show a little bit, or I'll show a couple of the projects from other fellows. So this is the abstract. New York City, we're facing an aging population, which requires more inclusive, accessible outreach by community boards. And the question is, how can CB11 improve communication and service connections with older adults with diverse digital literacy? And so I conducted surveys and conversations with community members. I also developed a rubric for assessing resource sharing, engagement, and accessibility. And then I highlight best practices across boards. So I created this chart using the American Community Survey data. And so I already showed this to you guys already. So it shows that seniors really are the only population with growth in the district. And there's a similar trend across other districts. And so this is from a really great GIS tool. So on the left, this shows mapping disability and people who have a disability and no health insurance coverage age 65 plus, pretty much across the city in every district. Between 0 and 10% of people do not have health coverage who are disabled and seniors. And on the right side, we see that almost 100% of community members across all districts who are disabled and seniors have public health insurance. So showing that, with the risk of federal cuts, people who are older adults and disabled are at huge risk of losing the services that they currently have. And the community boards can play an important role in the event that services are defunded. So eventually throughout the process, I realized that ideally there would be institutional review board review when conducting any human-based research. So the research that I did followed the guidelines of the Belmont Report, including respect for persons, beneficence, and justice. And, through further discussions, I have to emphasize that this research does not represent all seniors in Community Board 11 and does not contribute to generalizable knowledge. The goal of this survey is to improve the effectiveness of Community Board 11 communications, and the outcomes specifically of the survey will remain within Community Board 11 and the Community Planning Fellowship. Does anyone have any questions about this?
Not yet.
Okay, great.
You may wait for the gallery session.
Sounds good. So these are so I created surveys. They had about 20 questions and were done in English and Spanish.
Okay.
And so here we're looking at some of the data that's derived from it. So the vast majority I completed over paper, showing that paper communication is still really effective, even though the majority of the seniors I spoke with have smartphones. The vast majority live in 10467 because the senior centers tend to be concentrated. And then this one shows about where they've found it from, which is mostly through senior centers, and 17% of the surveys were completed in Spanish. So in terms of other findings, about 61% of community members have access to internet at home, and about 78% of community members participating have a smartphone, and also 69% have a television at home. In terms of asking about use of the community board website, the vast majority had not ever used the community board website. And of the participants who do use the community board website, the top task is to attend meetings. So I also collected kind of quotes and qualitative information, and key takeaways are intergenerational and community support. Older adults often rely on children, spouses, senior centers, and home health aides for tech assistance. Peer-to-peer support was also very common. Oftentimes, seniors who have higher technological ability will assist others with tasks. And community organizations like senior centers and libraries provide important support in addition to food, socialization, and other services. But seniors also face significant barriers when utilizing technology. Aging-related memory, vision, and dexterity challenges can create obstacles. Also, for those with lack of social support, there can be challenges with troubleshooting issues. Many programs like Social Security rely on online portals for management of benefits, and the wait times on the phone are long. Additionally, places like Social Security are going to be phasing out phone services, meaning that mobile compatibility is vital because the vast majority of seniors have smartphones and don't have a computer at home. And additionally, a common theme was loss of services and underfunding. I heard repeatedly that, the center used to have tech classes 2 times a week, and now there's 1 time a week. Or they used to have field trips, and now there are none. Additionally, also there is limited financial assistance for internet cell service and devices. There used to be the Affordable Connectivity Program, but it was closed last year. So in terms of getting assistance with home internet, the only program existing right now is for those residing in NYCHA called Big Apple Connect. So then I created this rubric for assessing community board websites. So the categories include accessibility and navigation, including things like alternative text on images, screen reader compatibility, font size, and language. And then topics also include housing and assistance resources, medical and mental health resources, social services, legal and resources, community and crisis support, and then community engagement and contact information, which kind of follows like governance. And so this is the scoring for Community Board 11, showing that Community Board 11 does really well with the accessibility and the governance. Community Board 11 really, I think, exemplifies with the governance. A lot of the other boards don't have updated agendas. They don't have past bylaws or even current bylaws on the website. Community Board 11 also has YouTube meetings posted, really showing that there is, strong emphasis on those topics. But there are we are lacking resources, specifically with like tenant rights, eviction prevention, access to mental health resources, food banks, LGBTQ resources, legal services, and also things like domestic violence, reentry support, disaster preparedness. So there's a lot more areas that could be included on the website. And so this is the rating for all the community boards. So as we can see, there are many boards that do not have resources for social services. And the interesting thing is that many social services are administered at the community board level, yet the community boards are not distributing that knowledge about which services are being covered in their district. So my next steps for this project is to create resource guides. So I've started working on it. There's a lot of services, things like case management, that are done at the community board level. And I believe that the community board could play an important role in facilitating that connection and disseminating the knowledge that services are largely provided at the community board or school district level, and sometimes also by zip code. And then I also believe that the board should continue to pursue research into the experiences of of marginalized communities, and CITI or City has really great trainings on how to do human-based research. And then on the right side here, this is the CB8. I think this one was CB5. They have some resource guides that are really great. And that was why they had such high ratings on this scale, because they had these kind of comprehensive PDFs showing, you know, the local home-based locations, the local senior centers, how to get the services. So I believe that Community Board 11 should try to emulate those types of resource guides. And they're just PDFs that are uploaded. And I'm also recommending that Community Board 11 continue to participate in the Fund for the City of New York Community Planning Fellows Program. And so now I'm going to move into some of the projects by the other fellows. And so there's about 24 fellows, so this is just a handful of them. So my colleague Isabel, she did an analysis of the housing availability in Midtown Manhattan and was able to identify all of the developments that have happened in like the last 10 years and the types of funding that they use to create affordable housing. And then Sonia, she did a map of all of the public bathrooms in Midtown, and she also conducted interviews with the staff at them. So many of these public bathrooms are in privately operated public space, which I don't think there's many POPs in Northeast Bronx. But you know, this type of project of mapping aspects of the built environment is something that could be very well done by a community planning fellow. And then so this project was from someone who was placed in Bronx Community Board 12, and she identified vacant lots and assessed the type of zoning that was present. And so she also was able to discuss the effect of the City of Yes. I think that's a charter revision or zoning revision, rezoning, showing that you know, within certain specific areas of Bronx 12, new housing could be built, or single family homes could be turned into multifamily homes based off of the new policy with City of Yes.
Look at what they're doing on Seymour Avenue. They tore down the house that you see on the 2200 block of Seymour.
Oh, I know, yeah.
Okay. And then, so this was another project that was really impressive by Emma. And so her project was in Greenpoint in Williamsburg. And so she integrated, there's like 3 or 4 systems for independent agencies used for tracking land remediation, which is when, or environmental remediation, when there's contaminants in the ground or water. And so she was able to overlay all of these data sets and map them all across the district so that you know, different stakeholders can understand what are the environmental hazards, you know, and where are they, and what the where they stand on the process. And I think one of the most important things that she did was to create a dictionary and rephrase the kind of professional jargon into easy to understand statements so that community members who are looking at her map will be able to understand exactly what is being done and why at each site. And that's everything. Does anyone have questions?
Yeah,
Do.
All right.
say who you are.
My name is Pat, and I'm one of the members here, and I just wanted to ask, what, you said something about seniors, a lot of them don't have computers, and the ones that do have computers really can't navigate them. So like you said, where would they take these courses? I mean, you're saying that the community board offices, the office would offer it? Because I'm like, the libraries are not doing that.
Libraries.
Yeah.
They are cutting them out. They
So
are.
currently the libraries do offer tech help classes, and the senior centers also do. But the tough thing is that people really need assistance.
Yeah.
And so they need access to human capital. And so there certainly are places that we can refer community members to. The Bronx Borough President's Office has an ombudsman program that does really great work helping people with chronic health conditions or who are in nursing homes. So they do really great work. And then there's also the version of my job, New York Connects Bronx, done by Neighborhood Shop. And then they can also provide a similar type of support. You know, I'm frequently printing out and mailing applications to community members in Brooklyn. So I think identifying these service providers that provide assistance in addition to information is really vital. But I also believe that the community board can serve to do that work, especially, I mean, it will have to happen, right? If places like Department of Aging lose funding and cut services, as they already have. I mean, so they're going to be cutting more senior centers, and that's coming. They've kind of stalled on that because more things might be cut at a greater level. But before Trump came into the office, Department of Aging was still going to start cutting senior centers.
Right.
So I really believe that community boards are in an important position to be able to serve as assistants, but also to support community members who are already engaged in caregiving and community service. Rather than just providing those the board providing those services, I think it's much more powerful if the board can provide resources that are used by the community members who are engaged in service.
And how would we get the services?
Yeah, so I think it's first, like, we have to stay up to date with the landscape, and it's quickly changing. So
Right.
I'm going to create a resource guide, you know, that responds to the resources that we have currently. But I think ideally we can say, look at the website and it will tell you exactly where to go for these certain topics. I think that would be a great first step.
And
But then also, you know, Community Board 11 does have a capacity issue. And so that's something that would have to be, assessed differently.
Thank you. Kay Cardona had her hand raised. Kay, unmute yourself.
I think I have to ask her.
All right, hold on.
Madeline, will you share your project with us? Will you send it to the? to us?
She will.
She will.
She has to.
Okay. No, like.
Oh, the PDF, you
The
can send it
PDF.
to the board.
Yeah, so I'm hoping to create kind of a more official version that would then be distributed to the board. And then I'm also hoping to maybe, you know, collect this feedback and provide a more concise presentation at the general board meeting if that's something that
Only because the
works out.
PDF because I take notes, and if I missed anything, I just want to like look through it. Is that
Okay, yeah. So after this meeting, I'll send it over to Jeremy.
Okay, thank you.
Thank you. All right, Kay.
Hi, everybody. Good evening. Hi. A few things, especially Madeline wouldn't know because she's kind of new with us. First of all, some of the people that serve on Community Board 11 have been serving for decades. They're seniors. Second of all, some of us that are here, like I'm here 33 years, as of next month, 32 years doing community stuff. Third of all, I'm a CNA for 22 years. So some of the people on Community Board 11 know me from different community groups. And they know I not only work with seniors, I am a senior, I'm a community activist. At any time, they could reach out to me and any other community activists to get the word out. I do on occasion go to Bronx House, which has a OAC program. I was the community outreach person, you know, at one time, but I got very sick. So the last several months, it's been extremely difficult for me. The next thing is most of the seniors in this community, no matter what part of the community they're in, they basically look to their local community groups before reaching out to CB11. They'll reach out to CB11 if there's some kind of issues like potholes or something that requires community board input. They'll reach out to Pelham Parkway Neighborhood Association or Allerton International Merchants, one of our local groups. Because, you know, the seniors that serve on Community Board 11, some of them, have belonged or do belong to community groups. So that's one thing. Second thing is a lot of what you said is true. As a senior and a senior that works with the elderly, I see what's going on with all the changes, and with this current administration, even I'm feeling it, because I got a letter to, like, so far they haven't touched my social security, but they recently, I had a conversation today with Medicare and Medicaid. I'm no longer qualified as dual eligible, and I'm poor. I'm a disabled senior on SSI. I can only work, I'm only working maybe 10 hours a week now due to health issues. And yet they're telling me I have to be in FFS or FFS something Medicaid. So it's, you know, I see what's going on, and other people have complained to me too, that they're seeing changes going on. So the fact that they want to cut money to senior centers is just, you know, it's going to be devastating for people. As far as the computer classes and computers are concerned, I have high-speed internet, and yet my phone still doesn't work any better than it did before. And one of the reasons why I got it is I thought maybe that this smartphone would operate better. And to tell you the truth, yesterday something happened with Gmail, and I went to physical therapy. The receptionist fixed the phone.
We're stopping you. Do you
I'm
have a
sorry.
question?
No, I don't have a question. It was just comments. I'm sorry.
Yeah,
And stuff, but I just
Cardona,
wanted
I
to-
really do hear you. And something that I picked up on in Bronx Community Board 11 is that there are so many community organizations, and people are so engaged in the community, and so many people are involved in community service. And I think that the board would be really great if the board had kind of highlighted organizations that you can get involved with, or places to get support, ways to take action and engage in advocacy. Because right now, all of the organizations are just in a list. And I think that if there were more, if the communication was more targeted to get people into action, I think that would be really great. And we do have to get prepared at the risk of losing these services. I think, every day I speak with community members who are facing food insecurity, the most basic issue, and we're struggling to get them Meals on Wheels, or we have to coordinate it. And I think, if, these services get defunded, we're going to have to address the immediate emergency issues of, mental health crisis, food crisis, and housing crisis. And
Who's gonna
having,
reach out though? Who's going to go and check on the seniors that don't go out? And a lot of them live in buildings, so it would be good
Yeah.
if there was some tenant leader or somebody that could check on the seniors that are basically, they don't go out except maybe once a week or whatever. There are people that are going to starve. They're going to go without their medications. I already see that going on
yeah,
for
me
years
too.
and years. So this is very frightening to me that
It is.
I'm going to hear more about, oh, Mrs. Smith, you haven't seen her in a month because she's dead.
Hey, I don't
I'm
want
sorry.
to,
I'll shut up now.
we know the issues, we understand them. Please,
Yeah, so Ms. Cardona, I really appreciate that feedback, and I'll definitely be getting in touch with you.
Thank you.
thank you.
Sorry.
All right, Dr. Tutu has a question.
Hi, Madeline. I'm so happy that you finally completed your survey. You did a wonderful job.
Thank you.
Thank you. Thank you for this. And thank you for what you did for our community here. And
Thank you.
working with DM here and all of us. I really appreciate it. So as I just like to see more done, if you can really get involved, like the comparison you did with the other fellows, to see how you can really emerge and be part of CB11.
Yeah, and so my work is definitely not over. So I'll be creating resource guides. Right now, have resources for, specifically for eviction prevention, and getting family services. So I'm going to create those resource guides. And I'm also going to create a guide of, there's so many tools that use mapping or GIS. And so I'm going to create a guide showing all of the ones that I've come across, and showing how the community board can use those tools to inform the policies or actions that it takes. And And then, so something else that I'm looking forward to doing is I'm going to write an article. There is a journal, I forgot what it's called, but it's going to be about why social workers should engage in non-traditional field placements and the things and skills that you need to have in place to be successful. Like having good supervision, seeking supervision from people in the community, like I did many times with you, Dr. Diallo. And also, I have like a specific like forms that I use to track my progress. So there's a couple, my work is definitely not over. And I'll try to create a more official write-up that the board can have of my project.
Thank you.
Right. And by the way, you know that the borough president put out a guide when
I
spoke.
did. And so I'll be reaching out to them this week to get a copy of it.
All right. Thank you. Kate.
No, just her hands. She didn't put it down.
Oh, okay. All right. Is there anyone else who has a question or a comment?
Department agents said their budget has not been cut. It's the same as FY25.
Yeah. So I think if we're aging, we should be good until the rest of the year. Also, many of the programs are already funded for the next couple years.
No, but this budget FY26, that's going to be this April or June. Department agents said they have no proposed cuts. It will remain the same as FY25, which is starting from June 24th to July 2025. So there has been no cuts as of this fiscal year for Department of Aging.
Is it the New York Department of
New
Aging?
York City.
But so at the federal level, it's called the Older Americans Act. And so Trump has not taken any actions yet to attack it. But we have to see. Also, like if things like Medicaid and Medicare got cut, that would put a lot more stress on senior services like Meals on Wheels and congregate meals that are already undersupplied. Does anyone else have any other questions?
All right.
All right. Well, thank you so much.
Thank you, Alan. Very, very well done.
Thank you so much.
Call me anytime. She does it. Okay. All right. Some old business. I just want to bring up the health fair is very quickly.
Anybody that wants to talk in the gallery about something else?
Oh, I'm sorry. Is there anyone else in the gallery who wants to say anything?
You want to be?
Go ahead, Roxanne.
So since you mentioned seniors, the prior meeting bylaws, you just approved the motion to require 36-hour in advance registration, despite the fact that committees are rarely held. If held, we barely have a quorum. With this opportunity, you said that people have a committee does not exist. Public hearings are meant by city charter to be for a specific topic, not because one board member is like, or for people to talk about things that we're not interested in at the full board meeting. We had last month several seniors who came in person to speak about issue regarding the proposed drug rehab or opioid center. You had if you had proposed that last month, you would have been denied to speak. You have two district manager and a board member, Ryan Bertel, who's actively trying to restrict certain people from speaking, including me, because they don't like what I'm saying. But why are you so frightened what I'm saying? Is it because there's validity in what I'm saying? Because if I was a crazy person, people wouldn't care what I'm saying. But obviously people are listening to what I'm saying. No district clerk had a meeting held for a year. Fact. Even though people say, not once have you ever seen a minute for you to say that it was valid, shame on you. And believe me, all your names will be revealed soon about what we just did last month's prior committee meeting. You're saying no information, you violate old code of conduct. You're prohibiting people from registration in person on the same day as been done for over 40 years because of one board member or one district manager that don't like criticism. And that should be a shame of you. You should all be ashamed of yourself. Thank you so much.
Just for the record, we didn't remove the sign up.
Yes, we did vote this
No,
motion.
No, we didn't. The 36-hour thing is there, but so is the sign up sheet. We did not
Yes,
remove
it's
it.
not.
That
We
was
didn't vote,
not,
we didn't vote.
You voted
Okay.
for Tyree right up.
No, but
this
it's-
is on a separate meeting.
No,
This
but
is not
you don't
health,
know
but
what
just
you
for
did
the
before.
record, if the amendments did not remove the sign up sheet, the sign-ins,
It's
form in the
required
beginning.
in advance registration only.
It kind of contradicts each other. That's something that has to be addressed later, but at the moment, you're still able to put in a sign up
To-
slip.
Correct,
For
To the
vote
full
this
board.
month.
yes.
Yeah,
Yeah.
that's fine.
But when they vote for it,
That's not being
It's-
voted to remove it, but again, that's not this
We're
meeting.
still
This is
hashing it
health.
out.
They still have to get
if
out.
you just go and you just let that guy lead the meeting, pushing for agenda against the
We did
goodwill
it,
of the community.
right, but we
Why
didn't
be
vote on it.
You care about community. You didn't make tonight last time over here. You win. I won't be here anymore. You win. Congratulations.
All right,
Stay like you.
anybody else? I'm sorry, I'm not part of the committee, but we
It's
gotta move it
okay.
along.
We have to move on. Is there anyone else?
No,
I don't know.
Okay, back to health.
Back to health.
Right, back to health. We all need our mental health
Okay,
back in order.
all right, so,
Is there, all right, I wanted to, there are no motions, but I wanted to bring up old business.
whole business.
That-
Okay,
I have about 17 or 18 tables
okay,
at the
great.
health fair. I would appreciate it if some of you would help out on the day of the fair, helping put up the banners, which I'll have to remind Cynthia and Jeremy that we have. And to just walk around, meet with the people, etc.
I know you've mentioned it multiple times, but what date is the health?
Right
And
date.
It's May 18th.
May
It's the
18th.
week after Mother's Day.
Okay,
And I heard that Howie Martin is retiring,
yes.
which is, wow,
Really?
I know.
that, I mean,
I thought
He's
you
been
were
there
already
forever.
retired, no?
I don't know.
I don't
Do you know anything, David?
No,
I just heard that he's retiring.
Oh,
Yeah.
okay. So I don't know if he retired yet. And no new business at
Yes.
this moment. Yes, go ahead.
May 18,
It's a Sunday.
location.
Bronx House.
The Bronx House.
That's at 990?
Yeah.
Helen
yeah,
Parkway
990
South.
Collins Parkway South, right.
You know, after typing it all the time, I gotta remember. So hopefully, and there'll be different, certain people like,
What time?
from 12 to 4, like Michelle, the one from the Selkoff Center, she's gonna have a table.
Mhm.
And Madeline is gonna do with her survey, so we're getting different, all kinds, and
That's
Union
nice.
Community Health, you know, Serena is always there, and
Mm-hmm.
so we have a lot of, and of course, the Black Nurses Association, who
That's
did
very
they were very good, who did the, you know, had to do
Mammogram?
with an infant or a young child.
CPR?
CPR,
Oh.
yeah. So you know, I keep trying and other health facilities. And if you know of anyone who you want. Okay, so that's it. Is there anyone else?
If you need help setting up, what time would you want people to be there to help?
Probably around 11:30. I'll try, because parking is
Yeah,
always horrible. I
parking is
try to. I
I
start-
I'm sorry, I'm not gonna be there. I'm sorry, I'm on a trip. I will be away. I'm sorry.
Can I join you?
You could.
Okay.
Look,
Sandra, do
you have, we all have our own lives. Okay, so I make a motion.
Choose,
Do you have a list that we can look at and see if we can add more?
Yeah, well, I have my list and I have
Oh, your own list.
my own list. If I have your email, I could make a photo shoot. I just wrote it out. I haven't typed it, but I have it.
Yeah, send it around so this
Yeah,
way.
so we could.
Yeah,
I'll see
yeah,
who is this, so we don't
Right.
duplicate, we can add more.
yeah. Oh, there's some duplication, you know, like Alera Health and First Health, you know, they all wanna come and sell their products or get you involved. But yeah,
Okay.
okay.
All right.
Anyone else?
I'm wondering, I mean, I know it's health and social services, but it might sound far out. But how about like, because we have a lot of people in the community that are, you know, with pets, they're like really big. Is there like anybody that could come in and talk about health for animals?
We
If they
had,
had, we had someone, we had a woman who
Did.
used to, have therapy dogs come to the health
Yeah,
fair.
that's nice.
But it's out there and I haven't heard from her.
I'll
Who knows if
him.
she's
I
still around?
don't
Yeah.
have, yeah.
You know, I don't know.
I think it was through, I think that would be like a nice draw, like.
No, I have John Doyle. I had to send him a reminder again. You know, but,
I think it was through Jacoby.
no, I thought she did it on her. I'm not 100% sure, but I contacted and
Does
You
Jacob
know.
still have, pets that go into?
I don't know.
They
Oh,
used to
yeah.
have training
They
things
used to
too.
have
but
training.
they-
A lot
they
of
just
things
took the
happened,
dogs
you know,
that
with
was-
During
COVID, a
COVID.
lot of things went
Yeah.
Down the
south.
drain
I know.
literally. Yeah,
So
so,
maybe we
but
could look into
the
that.
therapy dog was wonderful. So
Yeah,
we shall see. But yeah, if you know of anyone, you know, who
yeah.
something.
And that guy who came here, remember, he's here at the last meeting, and he had wasn't acupuncture, it's like.
Oh, yeah, he's
somebody-
coming.
He's coming.
The
Okay,
young
good.
man who does works with young children and they help out. And it's around here now. He has a thing
Yeah,
on
he has-
Forest Farm. So, you know, we try to get whomever. All right, so shall we call the meeting?
Okay.
And I make a motion to adjourn the meeting,
Time is 8:17.
8:17.
Thanks, everybody.
Dave, thank you, and David, thank you
What
for
time
your.
did we begin the meeting?
7:26.
7:26.
Thank you, everyone. Be
Thank
safe.
you.
Have a nice night.
Thank you.